Most of our patients have bruxism problem. It's mostly during sleep and sometimes also during work or during daytime. It has different causes, but most of them is the stress. Because of the stress of the work or daily life, most of adult patients have bruxism problem, and there are some treatment methods. The easiest treatment method we use is night guards. We just get some impressions from the patients and prepare a thin night guard, and we ask our patients to use it during sleep, and it makes our temporomandibular jaw feel not that much pressure and helps bruxism. And the other method is injecting some Botox into the chewing muscles.